Hey, welcome back, everyone. It's Jeremy Thiel here from Driver Check. Our next speaker is another familiar face, Dr. Jonathan Davids, who's a corporate medical director. And for this theme of this segment of the show, we propose the question to the crowd, ask the doctor, ask Dr. Davids. So we know there's a lot of misconceptions, a lot of myths out there about vaccines, hesitancy, COVID testing. So we want to use this as a forum to, ask a trusted, reliable physician like Jonathan here. And with that, Jonathan, welcome to the show.
Thanks, Jeremy.
So we'll get right into it. So when we had polled the crowd, we had a bunch of different submissions. So we thank for everyone who participated. We'll try to get through as many as we can today, but we did select the ones that seemed the most topical, relevant, and the questions that had been asked numerous times. So with that, Jonathan, one of our first viewers had asked, since I have mixed doses, how can I get a third dose so I can now go on cruises again?
Well, it's a good question. A lot of people are asking this because various countries and certainly cruise lines are not accepting mixing and matching of vaccines. And like we know in Canada, we did mix and match, especially during the third wave when people got AstraZeneca initially and then followed up with one of the mRNA vaccines. So the bad news is that I don't think that we're going to be able to get booster doses for travel purposes, not anytime soon. In fact, Canada has considered booster doses only for a select population, and typically the population is a vulnerable population with an immune system that's suppressed either through disease or through treatments. And so there's a recommendation that that group of people get a booster dose. And with that, there's no consideration for adding a third booster dose so that you will appear to have two mRNA vaccines so that a cruise might allow you to join or to go to another country. I do know that for international travel, the federal government has been lobbying other countries to allow or to consider mixing and matching of vaccines to be okay for travel. But I don't think this is going to happen with cruise lines anytime soon, unfortunately.
Yes, and as an avid cruiser myself, I can't wait to get to the boats. I used to feast a lot on the buffets there, so I know a lot of people are clamoring to get back to that. So, and again, I know it's fluid, so I guess over time we'll see how things potentially change with what they're allowing, right?
Yeah, and on the flip side of it, Canada has 4 approved vaccines, and if people from other countries don't have any of those 4 approved vaccines, they still, if they wanted to travel to Canada, they would still have to abide by mandatory quarantine rules. Over time, Canada has indicated that they're going to consider other vaccines to add to the list, to the already approved list that we have in country, but they might add extra types of vaccines to that list so that they can approve travel without quarantine. So with that, there's still hope that other countries will do the same, or even cruise lines will reconsider that and offer some options to our travelers, really.
Okay, I'll be sure to send this link and video to Caribbean Cruise Lines in Norwegian. Okay, next question here. So I have gotten my COVID vaccines, but should I still be getting a flu shot? Is there any research to show whether this has any effect on the COVID vaccine?
Okay, so it's a two-part question. First of all, COVID and influenza are 2 very separate diseases. They both affect the respiratory system primarily, but they are 2 very separate diseases. And so getting one vaccine will protect you against one exposure, and getting a separate vaccine will protect you for the other. So the advice is, yes, get both of them. Get your COVID vaccines, but also get your influenza vaccine. There's no real evidence to suggest that by itself, the influenza vaccine is going to have any untoward effect with COVID vaccines. The whole premise of getting vaccinations, provided you're not getting them too close together. Some vaccines you can't get too close together. You have to have a period of time between them. But generally speaking, they operate independently and they offer independent protection for one disease over the other. The only caveat I will provide is that if you haven't received your COVID vaccine just yet and you're planning to get your flu shot, you probably want to give yourself about 2 weeks between one and the other. The reason for that is just so that we can try to delineate if you do have any untoward side effects that arise out of one vaccine, that we're not confusing the situation and not knowing which vaccine is responsible for whatever side effect is happening. So the current recommendation is if you have your flu shot or if you have your COVID shot, let me say, wait for 2 weeks before you get your flu shot, and vice versa. So if you're waiting till flu shots are available and then considering also getting your COVID vaccine, you probably have to separate that out by a couple of weeks.
Okay, great. That's a question we received from multiple people, so that's why we put it into the 2 parts. So great question. Our third question here is a very hot topic, and I know it's changing quickly and evolving, but the question is, are the frontline staff required to be fully vaccinated?
Yeah, so it depends on who you're asking, which perspective you're asking this from. So generally speaking, in most of the provinces, there are some vaccine mandates that have been handed down, typically by employers of hospitals, employers of long-term care facilities, frontline workers, or anybody that's working really in healthcare, certainly in emergency response. Those are the people that are going to be exposed to the now circulating and highly infectious Delta variant. And so in order to protect not only themselves, but also their coworkers, the employers are instituting vaccine mandates. Some of them are pretty strict, so that if you don't get vaccinated or show proof, then you're on suspended time off and could potentially be terminated for noncompliance of that policy. Yet others are moving to a vaccine or test. So if you don't get a vaccine, or if you have a vaccine exemption, you can still go through and get rapid antigen tests, typically about 2 to 3 times a week, to demonstrate that you continually are negative in order to service that role. So, frontline workers, high risk individuals, high potential for them to transmit this virus to other vulnerable people. So really a good idea for frontline workers to be fully vaccinated. There is no provision in Ontario to have this mandated, so it's left up to the employers, whereas in other provinces like Quebec, it is a mandated thing to do.
Okay, thank you. So for anyone in the audience, follow what your provincial regulations are. Your employer may be different than your neighbors, and they might have different rules and regulations. So just be mindful of that. It's not a one-all be-all solution for everyone. So, yeah. Okay, so our fourth question is, what would you advise people who believe that they do not require the vaccine because they think herd immunity will take effect once enough other people have gotten the vaccine?
Yeah, this is a good point to raise, and I'm glad the question came through. We've been talking about herd immunity and how that is going to be a factor in protecting populations. And just to level set what this means, so herd immunity just refers to a percentage of the population that, when immune, will have enough protection afforded to everyone in that population, so that any new infections that are introduced won't have a chance to spread, because there's no vulnerable people, there's no susceptible people, I should say. So with the original strain of COVID, we anticipated that we'd need probably about 75 to 80% of any given population to be immune in order for us to benefit from herd immunity. With the Delta variant that is circulating, because it's so much more contagious, it's so much more transmissible, we are expecting that herd immunity can only be achieved once we're over 90% of the entire population that's immune. So that's either through vaccination or previous infection. Our current vaccination rates are, for Canada, are holding at around 70, maybe just a little over 70%. So we're pretty far away from the anticipated 90% of fully vaccinated individuals that we need to have herd immunity from. So I think, at the end of the day, I don't think we're going to achieve herd immunity anytime soon. So for the people who are waiting for that, that protection that herd immunity will give them, I think that they're putting themselves on their back foot right now. I think that they're at high risk for picking up this disease. And current state, we know that the fourth wave, which the country is embroiled in right now, is primarily due to unvaccinated individuals getting sick, getting symptomatic disease, getting hospitalizations, and getting serious enough to be admitted into the ICU. The fourth wave, which was largely a preventable wave because we have vaccines and they're highly effective, we're seeing this manifest itself as a fourth wave of the unvaccinated. So my recommendation is not to wait for this, hopeful herd immunity. We might get there at some points, but it's not going to be anytime soon. And your best protection right now, in addition to still watching all the public health measures like distancing and masking, is to certainly get fully vaccinated for maximum protection.
So this has got me thinking, when we talk about the concept of herd immunity, did we not go through the same thing with measles, mumps, polio, chickenpox with those respected vaccines? So I'm just more curious, do you have any idea what the population, say in Canada, would have for herd immunity with those sorts of diseases that we've seen?
I don't know the exact numbers, Jeremy, but here's something to consider. We didn't even get to this concept of herd immunity before vaccines were introduced into general populations. We couldn't actually benefit from most people getting immune, because oftentimes in order to get immune without vaccines, you had to get sick. You had to go through the illness. There were some serious consequences. So that's one part of it. The second part of it, herd immunity not only depends on getting vaccinated or being immune, but it also depends on how easily these diseases are transmissible. How contagious are they? So to put things in perspective, measles, highly, highly contagious disease. So you need to have a significant portion of the population immune before you stop the spread of this. Chickenpox, less so. And right behind chickenpox is where we're seeing SARS-CoV-2, the virus that causes COVID-19. It's more infectious than influenza, slightly less infectious, or maybe equal to chickenpox, and certainly less infectious than measles. So we did achieve herd immunity with measles because we had universal immunization programs. Most, if not all, our kids are fully vaccinated with measles. Certainly, since the early 2000s, we've had a chickenpox vaccine, so we don't see large outbreaks of chickenpox anymore. So these are just not innocuous diseases. They have some consequence to them. Little kitties get admitted to hospital with serious complications. And so we've stopped seeing that because those populations have generally been vaccinated for vaccine preventable diseases, and we're seeing the benefits from that. So hopefully that message translates to everyone, and they can draw the straight lines to see that COVID is very similar to that. Getting vaccinated will give them the maximum protection. It's not perfect by any means, but it's pretty darn good. So 95% protection against symptomatic disease, and close to 100% protection against hospitalization in ICU, so serious complications and death with the current mRNA vaccines.
Okay, so thank you for clarifying that, because it's a nice segue into our next question. Because again, I'm in my 40s. When I was 5 or 6 years old, I received I had the chicken pox thanks to my sister, right? And that was just the norm, everyone's going to get the chicken pox, but hey, once you do, you'll never have it again, is what I was always told as a child. So leading into this question, it's two parts again. Should people who have already had COVID and recovered take the vaccine? And is it necessary from a medical standpoint?
Okay, so the current advice is yes, you should get vaccinated even if you've had an infection with COVID, natural infection with COVID. And the reason for this is we do know that when you have natural infection, you still develop an immunity to it. So you still develop antibodies. Antibodies are our immune system's proteins that are used to fight off this infection. But those antibodies don't last forever. They tend to wane. They tend not to hang around for more than several months. And with natural immunity, we've been seeing that that antibody protection is not consistent for more than 90 days. So your immunity tends to sort of wane over time. This is also dependent on how severe your initial infection was. So if you've had mild disease, you may not have mounted a robust immune response. And so your antibody levels may sort of taper off much earlier. If you've had a really severe infection, you might have antibodies that last a little bit longer. But on average, we're seeing that immunity from natural infection lasts for at least 3 months, maybe a little bit longer, maybe a little bit shorter. When we're getting vaccinated, we know that there's a fixed dose. We know the response, and we've been able to measure this. Typically with vaccinations, we're seeing a 6 to 8 month period of time that immune systems can protect you. We know that people who when they get COVID and they have a vaccine, they boost their antibody response to over 5 times that of even a fully vaccinated person who didn't have COVID. So they get significant protection from COVID and from vaccines. And so going back to the first question a little bit, somebody asked, when do I get my third dose? Can I get my third booster dose? Mm-hmm. And you just need to think of, getting vaccinated after having COVID as getting that third booster shot. You're going to get significant more protection for you. And so you're going to be much more well off. So the current recommendation is still that. Is it medically necessary? That's a hard question to unpack. I don't know what that means, that it's medically necessary. If you're saying, is it going to give you the maximum protection? Then the answer is yes, it will. If you didn't get vaccinated, you will still have some protection over a short period of time, but that's probably going to wane. So you may not be protected. So again, is it medically necessary to get vaccinated in order to get further protection? The answer would be yes. And one last thing on this, I know that vaccine mandates and vaccine exceptions are a hot topic. Having COVID naturally does not exempt you from getting a vaccine. So it's not a medical exemption to get a vaccine. It is still required. And so you can't go to your doctor and say, listen, I've had COVID. Can you write me an exemption letter so I don't ever have to get vaccinated again? That won't be accepted.
Okay, so thank you for that. And again, this leads nicely into the next question. So for those people who have already had COVID and they've recovered, do they have a higher or lower chance of catching COVID or spreading COVID compared to someone who is vaccinated?
So again, if you've had COVID, you've got some level of protection, right? So, and this holds true for people who are vaccinated. If you've gotten fully vaccinated, you have some degree of protection. We do know that despite having COVID, despite being fully vaccinated, we are seeing breakthrough infections. They're not happening that often. And to put things in perspective, they're happening less than 5% of the time in fully vaccinated individuals. So, but we are seeing breakthrough infections. And what that means is that people are getting exposed despite having protection for themselves. So they themselves don't get sick, but they're harboring this virus and they can be spreading it. So we also know with these breakthrough infections, even if you're vaccinated, and you can draw the line that even if you had COVID before, if you get exposed and you have this virus in you, you're equally likely to spread it to anybody else. So the chances of you getting it is much lower. But if you do, then there's a potential that you are just as infectious as somebody who had never had it, who's currently sick. So all that to say, having COVID, naturally, if you survived it, fantastic. You've got some protection. Please get fully vaccinated so you get maximum protection. You lower the risk of you contracting the disease yourself, and that in its own way will prevent transmission to others, right? And it's no different if you're fully vaccinated as well.
Yeah, and we've had these conversations before. And for the audience, Jonathan, as our corporate medical director, has been keeping all 700 driver check staff well informed, and it does give me a lot of peace of mind because I take that information, I share it with my family and my friends. But just understanding that you're just as contagious if you're vaccinated or not, if you're carrying the disease, that to me was really eye-opening. So
yeah, but you're less likely to carry the disease. So that's the caveat. So,
yes.
It's going to reduce the actual infectious rates. If you happen to be the 1 or 2% that get infected, then then you're just as contagious as anybody else, but you're certainly not going to be getting infected if you're fully vaccinated and protected.
Mhm. Okay, thank you for that. Okay, so our next question goes into the vaccination cards route. And I know this is again another hot topic. So the question is, should the proof of vaccination cards take into account people who have had COVID and recovered? Second part, should they be considered in the same risk category as someone who is vaccinated?
So again, just going back to my previous comment on vaccine exemptions, there is no vaccine exemption if you've had COVID naturally, so you can't get an exemption. With provincial regulations in a number of provinces that have been vaccine passports have been brought in, you actually have to show that you've been vaccinated. So, having COVID in the past will not get you to avoid showing your vaccine passport. And in order to have a vaccine passport, you have to get vaccinated. So the second part of the question was that, are they considered in the same risk category as someone who is vaccinated? I'm not sure I understand what that means, but I guess that, if you're fully vaccinated, you're a much lower risk category. If you've got COVID infection naturally, again, within the first 3 months, first 90 days, you're pretty well protected. We just don't know if that protection lasts beyond 90 days. So if you've gotten COVID and it's been more than 90 days, you might be in a higher risk category for getting reinfected or getting infected with a new variant that you weren't protected with initially.
Okay, thank you. Okay, so our next question here, it's okay, sorry. Our next question here, it's, would testing attendees and participants of social events be a better measure of prevention against the spread of COVID than a vaccine passport? And there's a second part that is, should they be used in combination with each other to further prevent the spread of COVID?
Okay, so the question really is testing for social events better than having a vaccine passport? And my answer is no. If you have been vaccinated, that will generate your vaccine passport. So it's better to have a vaccine passport because you've been fully vaccinated. And so we know that if you're fully vaccinated, very small risk of you actually contracting the disease. Testing itself, so you can imagine going to a Blue Jays game or a Toronto Maple Leaf game or Raptors. There are literally tens of thousands of people or thousands of people who are trying to get in there. If we were to try to test people right before the event, I think it's going to be a logistical problem. It's going to be a very costly thing for people to do, or they're going to have to do this. They're going to have pre-planned, so they're going to have to go get tested at least a couple of days before that event to demonstrate that they are negative before entering that facility. So I think the logistics and the costs really become prohibitive in those instances, and it's way better to have your vaccine and your vaccine passport to allow you, safe passage into those venues. Should they be used in combination? So we've seen that, vaccine people who've been fully vaccinated can in fact also get it. So there's a very, very small chance that can happen. So some organizations are saying, yeah, it doesn't matter if you're vaccinated, we still want you to test. So in those instances, it can be used, and they have been used. I think that you lose some utility with this because now you're using testing kits, which again aren't perfect. Their accuracy is not 100%. And you're getting to test a whole bunch of people who are very low risk for actually acquiring this disease. So we call this a low pre-test likelihood. So we're testing people that are not likely to have the disease with an imperfect test. There's a very good chance that that test can also give you false readings. So they could be falsely positive, which generates more problems. So in the right circumstance, I think you could probably use test and vaccine in combination. But for large groups of people, you just multiply the probability of getting a false positives by a false positive test with that result by the number of people that are being tested, which raises that number quite significantly. So statistically, probably not a great idea to keep doing testing in fully vaccinated individuals. Certainly, we are considering this. If people can't be vaccinated for whatever reason, then an alternative, an acceptable way is to use a rapid antigen test to give us a pretty quick answer of whether or not you are infected or not. Just know that it comes with limitations. It's an imperfect test. It's pretty good, but it's imperfect, and you have to consider, your false positives and your false negative readings as well.
Okay, thank you, Jonathan. Now, there's a lot of questions that are constantly coming up, and we know it's ever-changing landscape. So, and I know there's a lot of misinformation out there. So the theme is, again, take control. We know people have these sorts of questions that are new questions coming every day. What advice and suggestion would you give to our attendees on how they can continue to take control, stay well informed, and stay well educated moving forward?
Yeah, listen, it comes down to trusted sources of information. If people have a lot of questions, and honestly, they are legitimate questions. People have real questions that they want answers to. They're uncertain about it. I would say find a trusted resource. This could be a family doctor. This could be a physician of your choosing, somebody who's on the news. We've seen a lot of infectious disease specialists who've been talking about this. Find a trusted resource and pay attention to what they're talking about. And by the way, the resources need to have some experience and training in what they're actually talking about. So I wouldn't be looking at your friend on Facebook as a trusted resource when it comes to infectious diseases. I'd be listening to the experts. There is value in listening to the experts on this. And that's the way forward. It's establishing some understanding after listening to someone who you trust, or a bunch of people who you trust who are telling you what's going on. I think, across the country, public health has been leading the charge, and they haven't been perfect with the messages, but they've been consistent, advising us to, keep our distance, keep our masks on, get vaccinated. I think that message doesn't change. So trust the public health messages, allow them some flexibility. They've gotten things wrong, but generally speaking, they haven't led us astray. They've pushed us in the right direction, and I think that's where we start and end.
Okay. Well, I always love our chats, Jonathan. So thank you so much for attending the summit again this year. And I'm sure we'll be using this stage a little bit more often because we know there's going to be more questions coming in continually. So
thanks very much, Jeremy. It's been a pleasure.
All right. We'll see you soon later on in the summit.
Okay.
Thank you.
Bye-bye.